Welcome back to the deep dive. You know, a lot of you have shared info about chiropractic care, and one clinic in particular, AcuSTAR Wellness in Bangalore, keeps popping up. So today we're diving deep, our mission, to really unpack what chiropractic is, but specifically how AcuSTAR Wellness presents it based on the FAQs and info you guys sent us. We've got their website material, mainly FAQs. We'll try to pull out the key stuff, answer those common questions. You know, what is it? What's cost? Does it actually work according to them? Because let's face it, lots of questions flit around about this stuff. So let's start right at the beginning. According to AcuSTAR Wellness, what is a chiropractor? So they define a chiropractor as a healthcare professional focusing on the musculoskeletal system, meaning bones, muscles, nerves, that sort of thing. Pretty much orthopedic and neurological stuff, they say, especially the spine. And what's really front and center is their emphasis on natural, hands-on treatment. No surgery, no drugs. Exactly, they state that clearly. That seems to be a big part of their philosophy, which probably appeals to quite a few people looking for alternatives. And looking at AcuSTAR specifically, they mentioned Dr. Rudresh. Yeah, they highlight him. European certified, 25 years of experience. And not just chiropractic, they list osteopathy, allopathy, even acupuncture. It's quite a mix. Interesting background. So qualification-wise, they're not medical doctors like MBBS, right? Correct. AcuSTAR clarifies that. They say chiropractors aren't MBBS doctors, but they do have specialized training. Something about studying 32 subjects focused on spine, nerves, muscles. So a very specific, deep training in that area. That's the idea they convey, yeah. Focused on musculoskeletal health. Okay, so that gives us a picture of who they are. Now let's get into the what. If you go to AcuSTAR Wellness, what do they actually do? What services are on offer? Well, based on their FAQs, it seems pretty comprehensive. They kick things off with detailed ortho and neuro exams. Got to figure out the problem first. Then they mention osteopathy correction of the pelvis, which I guess relates to getting your pelvic alignment right for overall spine health. Okay. Pelvic alignment and then spinal adjustments. Yes, they call it soft chiropractic for spinal adjustments. Sounds like it'd be a gentler technique. What else? They list treating a whole range of musculoskeletal conditions. It's broad. Plus specific posture correction, they mention scoliosis and kyphosis. So adjusting structural posture issues without surgery, that seems to be the focus there. And they also talk about preventive care, giving advice on like how to sit properly, sleeping posture, trying to stop problems before they start. Proactive, is it sort of a standard treatment for everyone or no? Definitely not. They explicitly say they create personalized plans based on your age and your specific condition. They also cover managing chronic pain, back, neck, knee pain, even migraines are listed. Wow, migraines too. And they perform assessments of joints, spine, discs, nerves, plus the actual adjustments and manipulations. They also mention arthritis and knee pain management specifically, and even general wellness guidance. Quite a lot. Anything stand out as particularly unique? Well, the sheer range is one thing, yeah. Also, they mentioned doing advanced diagnostics without MRI or CT scans. Might be worth asking how they do that if you were thinking of going. Okay, so we know what they do. What specific conditions do they claim chiropractic therapy helps with? What's on their list? It's a pretty long list, and it mirrors the services. Back and neck pain, obviously, that's probably the first thing people think of. Sure, sciatica is high up there too. Spondylitis, knee pain, scoliosis, which ties back to the posture stuff. What about just general stiffness? I saw that mentioned. Yeah, body stiffness is vague, but yeah, lots of people feel that, right? Could be related to alignment or movement issues they aim to fix. They also list hip pain, headaches. Headaches again, interesting link. And sports injuries are on there too. Plus, just generally posture-related problems. Okay, quite the range. Now, big questions. Is it safe? Is it effective? What's AcuSTAR's stance on that? They tackle this head-on. They say, yes, chiropractic adjustments are safe, but the key is having them done by qualified professionals, like Dr. Rudresh. They emphasize his qualifications and experience there. Absolutely. They mention the thorough assessments, the 25 years of experience, using proven techniques. And they bring up that soft chiropractic again, plus techniques from Europe's Ackerman College, highlighting its safety protocols.